This is weird. Hello, Cher. Can you hear me? Oh, I'm sorry. Cher. You may have to type in the chat. I'm gonna get started at upright 4. Hopefully, you'll be able to figure out your audio situation. Let's see. How we doing? All right. Hmm. Oh, no, that's not what I wanted. All right, let's do this. Why did I do that twice? Hmm. All right, so it's upright 4. Share if you can hear me. Can you raise your hand or chat or something? There should be a chat button down there. All right. All right, I'm hoping you can hear me. So this is what we're going to do. We're going to get started. Hello and welcome. Thanks for hopping in. This is the, oh, I got one more, so I'll go ahead. No, we're not going to share just yet. Go away. Give me just a second, I'm letting somebody in. Hey, all right. Good to go. All right, just in time. So this webinar is actually a webinar that is covering health insurance and how to actually interact with and use the healthcare and health insurance systems during COVID-19 as we are home and kind of trying to figure things out and making a way. There's a lot of conversation that's being had about getting COVID covered, whether it's through your insurance or if you are not insured. But there's not too many conversations being had about just maintaining your health as a whole if you are a non-COVID-19 patient interacting with the healthcare system. So I'm looking to kind of cover that information. I'm going to introduce myself. I'm Kiana Brathwaite. I am the CEO and founder of KB Calls. My company is a firm that provides services to individuals, families, and business owners who have employees. We do healthcare education and planning. And all that really means is that we help you figure out what resources you have available to you to get you from where you are to where you want to be. And we provide ways of educating you on how to interact with the healthcare system. And I'm all about interaction. Interaction is very proactive and preventative as opposed to just accessing it when you have an acute issue. So I had to re-record. Of course, technology is wonderful when it works. So for those of you who were in the webinar yesterday, you'll notice there's a couple differences, but I still have on my student nurse shirt. Let me show you. I love this shirt. I came across this shirt during our move last year, and I've actually been wearing it a lot lately because for me, it reminds me that I am a student of life. So you don't stop learning just because you leave the traditional educational system. I continue to learn every day. And then, of course, I'm a nurse. I've been a nurse for, 2012, 14 years now. I've been in the healthcare system, actually an employee of the healthcare system probably since I was about 18, 19, so well over 20 years. And I also, so been in the healthcare system, and I started teaching when I was 14. So education is a big thing. Healthcare has always gotten my, not dander up in a bad way, but like I'm excited whenever somebody talks about insurance or questions. I always get excited. So we're gonna hop right in. I'm gonna share my screen with you. And let me find it. I was doing a little bit of research prior to getting started. Here we go. All right, so please let me know if you cannot see my screen. And what that looks like is you unmuting yourself and saying, I cannot see your screen, okay? All right, so we'll start off with, I did the welcome. Welcome, everybody. Thanks for coming in. Housekeeping rules, this is interactive. So at any point, because there's a lot of information I'm going to cover during this webinar, if at any point you have any questions, you need me to repeat something, something doesn't make sense, I'm going too fast, I'm going too slow, just go ahead and unmute yourself and let me know. All right, and I'll back up, slow down, reverse, whatever you need me to do. This is, as I said, interactive, very laid back. We are all home right now, so I don't want you to feel, there are no pretense, nothing, just enjoyment. As I said, healthcare, health insurance, all that good stuff, that really gets me going. I get really excited about it, and that may be weird, but as I said, I've been in healthcare for a very long time. So whereas sometimes it can be frustrating and daunting for most, I fortunately am able to figure out my way around it or work around. So did the introduction, Kiana Brathwaite, CEO, founder of KB Calls. My contact information, I made sure that that is here, that you can see it. So the webinars@kbcalls.com. That is how you will email me any additional questions that you have. And then the website for my company is resourceandhealthcare.com. And I will make sure that when I forward you the recording for this webinar, that you'll get a PDF of the notes from the webinar, so the webinar notes, and you will have clickable links, okay? So if you haven't RSVP'd through the paperless post link, that's how I'm collecting email addresses to know who I'm sending out the recordings in the PDF to. If you have any questions, use the webinars@kbcalls.com. And if you want to schedule a consultation, when you go to resourceandhealthcare.com, there is like a nice, pretty blue button, because blue is one of my favorite colors. Actually, it's my favorite color. There's a pretty blue button at the top of the website when you log in, whether you're on your device or your laptop. And that's how you'll schedule a consultation. And we could just have a conversation to go in depth. And I'll mention that at the end of the webinar once we're finished with our Q&As. So we're going to talk about the current environment right here, right? I know for Pennsylvania has several major players for health insurance companies. So Blue Cross Blue Shield, or IBX, most people know, Health Partners. So Blue Cross Blue Shield, Highmark, BCBS, and United Healthcare. Blue Cross Blue Shield has a lot of PPO options, and I believe they have maybe a few HMOs. United Healthcare has mostly HMO, and then they do have some PPO options. I have a couple clients who have maybe one or two interactions with the PPO side, but Aetna, big HMO. I mean, I think they may do PPO with their dental, but for the most part, their health coverage is an HMO type. Keystone Health Plan and Health Partners are big HMO players as well, right? So I want to take a step back because I'm using terminology here that may or may not be you may or may not be familiar with. So I'm just going to simplify HMO. Your primary is your go-to, right? So for anything, anywhere you have to go, you go to your primary. Your primary is going to be the one who outsources you and refers you to other specialists out in the health industry that can facilitate whatever is going on with you, depending on what your symptoms are. PPOs, you don't necessarily have to go to your primary. I know some people do to still have that conversation because they want them to know what's going on, but you don't have to go to your PPO. Myself, being a healthcare professional, I've had some stomach issues, and I've actually gone to see GI specialists. Trying to think who else. I've done my own cardiologist. Of course, even with, I think, HMOs, if you're seeing a GYN, they're considered a specialist. You have to get a referral. With the PPO, you just go to a GYN. Some HMOs fluctuate with that because I know some women use their GYN as their primary. So, you know, you depending on who's covering you, that's kind of your lot there. So biggest thing, HMO, you have to go to your primary. PCP, family practitioner, those are the different titles that they hold depending on your insurance carrier. You have to go to them to be referred out to someone. PPO, you don't have to. All right, so I know I have somebody on here from DC, and this is like one of the things. I know Kaiser Permanente. I'm from DC, so Kaiser is a big provider in the District of Columbia, and as you can see, Kaiser is HMO. Oh, I'm going to take a step back while we're talking about Kaiser because this also reminds me. Also, big difference between PPOs and HMOs. So HMOs do not have an out-of-network provider. They don't have out-of-network providers. If you do go see somebody out of network, I'm not sure that they reimburse. I haven't seen too many HMOs that reimburse for outside providers. PPOs do offer an out-of-network provider coverage. It's usually reimbursable though, right? And in network, out of network, that just means that the provider says the contracted amount that they have that they'll charge you for being a member of this insurance company is this amount, right? So if you are with Kaiser Permanente and you're in an HMO, let's just pretend like Kaiser offers PPOs and they don't. But let's pretend if you went to a non-Kaiser provider, then you would pay whatever that contracted amount is. I'll say the service usually costs, the contracted amount is $275, right? So you're going to them, you're going to pay out of pocket the $275 to the provider. And as a PPO, you have to submit some forms and go through the reimbursement process, and they'll reimburse you for that out of pocket cost on top of your copay. If you have an HMO, they don't have that out-of-network provider provision, so you're just going to be paying, you'll probably pay the higher amount, which would be, let's say $475 if you're going to a primary care physician. And I'm just throwing numbers out there so you can know the difference. I see that Cher is having some audio connectivity issues, so just know that you will get a copy of this once everything is done. Excuse me, I'm going to send a really quick text to her really quick. Forgive me, send. And so that's where that falls as far as the difference between PPO, HMO, and then in network and out of network. All right. Also, Care First looks like is a medical insurance company in the district, and they have a HMO PPO option. So that's just to show you that depending on where you're located, I may have some people who end up watching this who are not in Pennsylvania, but my focus is going to be on the Pennsylvania providers just because that's where the majority of my audience comes from. So each of these providers offers some information on COVID-19 and how they are handling patients, right, who test positive. I'm going to go into, let's see. Da, 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 da. Yeah, okay, so we're under Health Partners Plan. This is just their general website. As you can see, it says COVID-19 Health Partners Plan is closely monitoring the spread. And then they have resources based upon your designation. Are you a provider through Health Partners, or are you a member? Are you one of their clients or their patients, right? And then you would click on that and they would take you further in to understand what they're doing with COVID. But what we're talking about today is, all right, I'm not a COVID-19 patient. You know, I have other things going on and I still need to access the insurance companies. I still need to access the hospital, so forth and so on. So that's just, you know, the major players. And then I wanted to talk about, you know, I shared with you where to go for information. And then, you know, the biggest thing now is maintaining appointments, right? So I do have a section down here. I have two sections. So the first section we'll talk about later on, where I go for my COVID-19 information because it can be overwhelming. And then I have a section here for notes, right? So if there's anything that I'm sharing, I'm going to type it up, and that'll also be on the PDF. So really going to focus on canceling, maintaining, or making doctor's appointments, right? And with that, under that umbrella will fall, we'll talk about telehealth, and then the difference between ER, urgent care, and going to see your doctor. All right, so I've had a situation recently where I had my annual appointment scheduled with my primary care physician. I did it a year out. I couldn't even believe that a year had gone by that fast. But the office called and they said, okay, well, we're canceling your appointment. And I was like, okay, what was this appointment for? And they would, she was saying it was your annual. And I was like, okay, so you're canceling my appointment now. What does that mean? Like, if I need to be seen, what is your process? And I just found myself having to pull information from this person who was calling to cancel the appointment. Now, mind you, you don't know what the directive was. You don't know what information they have on the other side. But I also knew and recognized, even though this is something I do for people, both clients and family members on a regular basis, I remember getting extremely frustrated because I was like, I shouldn't have to pull this from you. I mean, if you're calling me to initiate something, then there should be some forwardness, a little forthrightness in, this is what's going on, this is how you can contact, this is what we're doing, this is what we're offering, and there was none of that. So the good news is, as I'm talking about maintaining appointments or canceling or rescheduling, Pennsylvania has now opened up their coverages to providers outside of Pennsylvania, because before you had to be a licensed provider in Pennsylvania in order to participate as a telehealth or telemedicine provider. But because of everything that's going on with COVID and the recognition that these systems may be overrun and we need to have more people available, Pennsylvania, the governor has mandated, that some of the processes that were in place have been waived, and they're opening up to non-Pennsylvania resident providers to provide these services through something like Teledoc, or I'm trying to think of one. I know we use Teledoc. So they're providing services through these telehealth platforms, and they have more providers that are coming in. Now, and so back to the appointment. So after getting off the phone with her and being able to get the information that I needed, I rescheduled my appointment for September. Now, that was a call that was initiated by the doctor's office. Not a lot of physicians are initiating these calls for various reasons. So you may have to, depending on your current situation, you may have to initiate the call. Now, a lot of people are concerned, worried about what happens. Haha, there you are. I could see you, sure. Yay. A lot of people are a little concerned about what does that mean when I'm the one initiating the call, right? So my father-in-law had an elective surgery coming up, and I, being proactive, was like, you know what, maybe we should postpone this because I don't necessarily see it making sense for you to expose yourself to this unless your situation worsens or we find that you need to go in. We can definitely make that happen. So for him, I called and initiated the rescheduling of his elective procedure, and it was frustrating again, right? Because the communication, again, you don't know what they're being told from an administrative perspective, and you do have to take that into account. But I had to kind of circumvent the normal way of doing things and use the contact information that I had for the person who did the scheduling of the follow-up appointments, and was able to get what we needed in that respect. So I want to give you a couple action steps, right? So if you're canceling, before you call, have an idea. Okay, so we're going to do this just so folks can see and you don't have to take notes. All right. Have an idea of when you want to reschedule, right? Have an idea of when you want to reschedule. Oops, not what, want. Brain moving faster than fingers. Also, I'm going to say have more than one way to communicate with the doctor's office. And what I mean by this is, so I called the main number and was sent to generalized scheduling and was told, well, you can cancel, but you can't reschedule. And I was like, that doesn't, that doesn't make sense to me. And she was like, well, we're not rescheduling anybody because of so forth and so on. And I knew that we were going to reschedule not within the month, but I wanted to reschedule out past June, just because to get a better idea of what was going on and to kind of let the dust settle with the health systems and let them figure out how they're managing just the influx of patients. So when I say have more than one way, if you've already scheduled an appointment and you have a person or a point of contact, try them if you're not getting anywhere, right? So so try a point of contact. Or I always talk about walking up the chain of command. I have a JROTC background. I was not in the military, but there always is like a hierarchy, right? A chain of command. So you can always ask for a supervisor. Oops, your needs met. Request a supervisor or a manager, right? And hopefully they are properly trained and will be able to assist you, right? So that's one way. And then when in doubt, I always say try tomorrow. Because sometimes you'll get a different person, right? And they may have a different perspective, or maybe you needed to calm down. Who knows? So try again another day. Okay, so that's with canceling. But having an idea when you want to reschedule, and then having more than one way to communicate with them or to get your needs met when you're canceling or rescheduling. And I'm trying to think if there's any other. Those are the two biggest ones, right? So if anything else pops up, I'll I always have to play with this, so bear with me here. There we go. All right. Now, if the initiation for cancel, and this is canceling yourself, right? If the cancellation was initiated by the office, give yourself a moment to think through what it is you need, right? So they could call and say, hey, we're calling to cancel your appointment. I always say give yourself the grace and space to even process the fact that it's being canceled. I mean, maybe you're traveling, you're out and you're grocery shopping, and it's not really a good time to process that, right? Give yourself grace and space. Um, right? So maybe you need to be called back. So, this isn't a good time. Can you call me back? And you don't have to tell them why. Just it's not a good time. Hey, I appreciate your call. Can you guys call me back, or can I call you back, right? Because you want to be able to go and take a look at your schedule and have an idea of when, if that's what they're doing, when you want to come in, right? So it's not a good time. If it is a good time and they're saying they're calling to cancel, then take a few seconds, moments, to really again process, right, what this call is about. Seconds or moments. I happen to be, I have a critical care background, and a lot of times I had to kind of think on my feet. So when somebody says boo, I'm like, what? So I can respond very quickly. Not everybody is in that place. And sometimes, even when I'm taken aback, I find myself going through a process and then hanging up and saying, oh, wait, I need to call you back. And that's okay, right? It's okay to call the office back and be like, somebody canceled and I had so many questions. I was just taken aback and I would like my questions answered. Right. So call them back. Now, I'm going to move after this into something else. I just want to check in. Does anybody have any questions? I know Levon, you're here. Sherry, you're here. Did you want to ask me any questions about any of what I've talked about so far? You feel free to unmute yourself.
I'm okay right now.
Okay, you're good. Awesome. Awesome. Does this make sense, Levon? Like, do you like do you want me to add anything? Is there anything that you think I'm not covering in this whole process? What could possibly happen?
It makes sense so far.
Okay,
Um, so
awesome.
I'll just wait.
Okay. No worries. Sure. I hope that you're able to like type in the share. I'm messing with you. I really am. I'm sorry. I hope that you're able to type in the chat and because you look like you're on your phone and it can be a little difficult. I just want to see. Yeah, I don't think you're muted. Uh, Nope. Okay, it doesn't look like you're muted. But if you have any questions, definitely I'll give some time at the end. So call them back, right? If your questions were not answered. As I said, the young lady called me and she was like, "All right, I'm gonna cancel your appointment." Now, if you are just, like, what in the world? Oh, okay. And then she cancels your appointment and then you hang up and you could go, "Oh, wait, hold on. Let me call her back and let so and so called and they're trying to, and I just have questions." So there's nothing wrong with calling back. It could be a day later. It could be a week later. To be honest with you, however long it takes you to kind of regain and build up those questions that you have, so that you are informed and empowered, right? And you feel like they've responded to you in a way that makes sense for you. Then take that time and do that. So that's if they're canceling an appointment. So I kind of covered a little bit too, and I'm playing around with this thing because me and this outline. There we go. All right. So we'll talk about changing and making appointments, right? So I abbreviate appointments. I always have. It's a bad habit. So changing and making appointments, right? And this falls right into the have an idea of when you want to schedule, and that can be a range, right? So have a range of availability, um, of available times, because not knowing what's going on with your office, you may have to have some flexibility. And I'll get into, if it's an urgent situation, how to handle that when you're doing the urgent care versus going to see your doc. So have a range of available times when you're changing and making appointments. Have questions ready, right, to be asked, because you want to make sure when you have the person on the phone, even though I am an advocate of calling back, But you want to at least have some idea of some of the questions that you want to ask because you're now initiating, right? So this is you're initiating the call. So you're kind of you're walking into this a little more prepared than if somebody's calling you and it's out of the blue, right? So have your questions ready to be asked. And I'm trying to think, just as I walk through our process when I initiated for my father-in-law, be kind, right? So this is a really big one. Be kind to the person on the other end, okay? They are dealing with the same level of stress and uncertainty that we are, right? And even more so because you are calling on behalf of yourself. And you've kind of had some time to think through, what effect this is going to have on you. And they are probably dealing with the day-to-day changes just like you are, and they're dealing with some angry folks, right? It was very easy for me to get angry with the young lady that called me because she didn't provide me with the information that I wanted or thought was necessary for me to be able to get what I needed out of that phone call. And instead of me getting angry with her, and I'm not gonna hold you, I was in my head like, I can't believe I'm having to pull all this information out of you. This is ridiculous. So in my head, I was doing that, but I would take a deep breath and I would say, okay, so what's the next thing that I need to ask? Okay, and and then I would just use that to kind of keep me calm and be able to ask the questions and get what I needed out of it. But I also was able to interact with her like she was a human, right? And as I interacted with her as she was a human and kind of laughed through some things that were frustrating me, it eased her and she opened up, right? So be kind to the person on the other end. They are human just like you are. They are stressed just like you are, and probably even more so in certain areas, especially when they're at work, because you don't know who came at them and how they came at them the first, before you called, right? So be kind to the other person on the other end. You will get so much more assistance from them if you are. When you're frustrated, right? And this is for me, maybe more so than anybody else, but when you are frustrated, feel free to say that. I'm frustrated by the situation. I'm not necessarily frustrated with you, and I'm hoping you're not taking this personally, but this is really stressing me out right now, right? So when you're frustrated, be open and honest about how you feel, situation, and they're more than likely to be able to respond better to you as a result, right? Because we can all identify with feelings of frustration. We can identify with feelings of fear. We can identify with feelings of anger. We can identify with those things. So, you'll have some people who's like, I completely understand your frustration and I appreciate you being honest with me. Here's what I can do for you. Sometimes you're going to hit a roadblock, right? And when you hit that roadblock, hang up. Don't hang up on them. If you have to, you have to, right? I'm not gonna hold you on that. But when you hit that wall in the call, say, you know what, we're not getting anywhere. Some of this may be me. I'm okay with that. I'm gonna let you go and try again, right? So when you hit that wall, let go and try your call later. I had this happen to me a lot when I used to talk to Pico. So I'm just I'm using my techniques when I would get angry and frustrated. I'm just sharing these with you. I usually do not get upset with folks in the healthcare space just because I'm very familiar with that. So I'm a lot kinder to my brethren, not necessarily my utilities, but I'm getting better there. It's a work in progress. So yeah, so when changing and making your appointments, those are the tips that I have for you as you're walking through that process. And I hope that you're able to get what you need. And at the end of this, I always say that everybody's situation is individual, and I'm offering the consultation piece so that you can get in contact with me so we can kind of walk through what your situation is. So we're going to move on to telehealth. Telehealth is fortunately, we're very fortunate, right? So a couple things. So we're fortunate now that we have a ICD-10 code, which is the system, the coding system that is supposedly universal. For the most part, it is, but it's the system that is used to bill, right? So it's how providers communicate to insurance companies what services they provided you. And that is how insurance companies decide what they're willing to pay the provider. right? Point blank period. That's what ICD-10 codes used to be ICD-9s. But now I think around 2018, 2019 was when it changed to the new ICD-10 codes, because they, every couple years, they restructure the coding system, right? So fortunately, we have ICD-10 codes as of the middle of March for COVID. And now, if there is something going on, they'll be able to bill your insurance based upon those ICD-10 codes that they now have available. When it comes to using telehealth for non-COVID type things, or if you're not sure, right? So there's a couple things that are going on. Some of the insurance companies, they already have a telehealth platform built in, right? Because telehealth was something that we were moving into before COVID-19 really the crap hit the fan in that. And that is a good thing, because it means that although the system may get overwhelmed, which is why you have states like Pennsylvania who are opening up the providers from other states and becoming available to provide services in Pennsylvania, the platform was there, right? So they're not having to build out the platform. They're not having to figure that out. They already have a process to which. So now it's just, how do you use it? I will see, I'm gonna go, if you can't see my screen, please let me know. I'm just, yeah, pay payment, that's not, I was hoping there was like a little search button. Let's see what, here we go. I like Blue Cross Blue Shield's Independence Blue Cross's website, because it's just so much more user friendly. All right, here we go. Telehealth, yes. What do we got? What do we got? Anything good? Wellness archives, COVID-19 testing. See, COVID-19 is a big thing. All right, let's talk about what is telehealth. So telehealth is virtual medicine. That's the easiest way I could put it. I'm trying to keep it simple. It is virtual medicine, right? So it is virtual medicine and it is triage medicine. What does that mean? That means that it is not necessarily in person, but it gives you a way to engage and interact with a provider when you can't get in. And that's what a lot of people were using it for, was to triage, right? If their doctor's offices were closed, they had a telehealth option. If you, I use it for registered dietitians, right? Because I'm really all about making my health a priority. And I think you saw the hashtag at the first page. That is a big KB Calls hashtag. It's one of the ones that I use quite often, because I believe that we need to, it's our accountability, our onus to make our health a priority. And in doing so, we find people that support us in doing that, right? So the platform's there. You can use it for triage. A lot of times it's kind of like the telephoning, right? When you would call your doctor's office and they were on call and they would call you back, and you would tell them your symptoms. Sometimes it enables them to be able to see certain things. Like, you got this funky rash. You don't want to take a picture of it, right? Because you don't want that on your phone. It's in a really strange place. So this allows you to be able to kind of show them that rash in real time, right? And that's just an example. A lot of times it's used for pediatrics, right? If families have very limited resources as far as travel, for one reason or another, this allows them to be able to access the healthcare system without having to worry about incurred costs or going into the ER unnecessarily and then incurring that cost, right? And then so that's how it's used. Certain companies are offering platforms already. Our health insurance has something called, they partner with Teladoc. And I actually can bring that up just so you can see. It should be here. Yeah, there we go. So this is one of the telehealth platforms, right? Is Teladoc, and they partner with our insurance companies, or our insurance company partner with them to provide certain services through the telehealth network, right? And they have board certified providers. If you have insurance, you can go in and ask them how this process works. So, and I always recommend getting it up and running before you need it. So let's do this. Telehealth, right? As with anything, preparation is key. So get it up and running before you need it. Because when you need it, that's when your tech is going to do something that's not supposed to. when you need it. That's when the server's going to be slow. That's when your Wi-Fi is not going to be working, like when you need it, right, to get that set up. And that process usually takes a bit of time. For me, just logging into our insurance portal. Hold on real quick. Okay, there you go. Logging into our insurance portal, it took me 15 to 20 minutes to set that up. And then the teledoc, I had to get on the phone and actually have a conversation with one of the reps before I got my login. So you always want to make sure you get that up and running before you need it, right? Being proactive is the best active. So get that up and running before you need it. Have your login credentials on hand, okay? On hand always. And then you can always, if you have any issues, call your insurance company, your insurance provider. I am not spelling right today. To ask them if they have this option, if they have or offer, right? Have or offer the telehealth option. If not, there are some telehealth platforms. So let's go take a look. I'm going to take you to another page. Telehealth. Why are we not? There we go. I helped a few people when they were signing up for health insurance. I walked them through. I actually recommended that they do pay the extra amount for telemedicine, just because, and telemedicine, telehealth. So telehealth, sometimes people use that as that's how a lot of us healthcare providers either get information or provide information, and it just means a virtual option. Telemedicine, same thing, virtual medicine. So you can, Google telemedicine platforms, telehealth companies, give them a call. Some of them do have individual plans. Depending on how you're accessing your insurance, right? So if you're going through healthcare.gov, yes, healthcare.gov, they have an ancillary service that you can add on. If you are going through an HMO, sometimes, like I said, they partner. If you have insurance through your provider, sometimes your employer, sometimes your employer offers a work-life benefit, or EAP, which is Employee Assistance Program. And through those, you may have telehealth, right? So I'm going to just put that note. So options for finding. Individual add-on. Employer provided, EAP, or work-life benefit. And then healthcare.gov, I know offers, oh, there we go. Hello. Wonderful. Offers, and I call it ancillary, right? An ancillary option. And that's just secondary insurance services. But offers ancillary, I'm going to say service. We'll go with what Google Doc just gave me as an option there. All right. I'm going to check in about telehealth. Does anybody have, oh, I see a hand raised. All right, great. I'm going to stop sharing real quick, because that's always interesting to watch me play around with the tech. So yes, Jamie, yes, how can I help you? Out here. If you're able to chat, Jamie, that's awesome. If not, that's cool too. I did see that you had your hand raised. Can you hear me? Okay. Okay, there we go. What if I lost my job? Is Cobra an option? Okay, so yes, Cobra is always an option. Did you hear the sigh coming from me? Cobra is very expensive, right? So with Cobra, when you lose your insurance, you have, when you lose your job, there's a certain amount of time that your employer will cover you through your insurance. Sometimes it is immediately ended. But I think they have to give you a grace period and then to be able to go into Cobra. And then other times you have like a 30 to 90-day grace period depending on your employer, their size, and what kind of plan that they chose. That gives you an opportunity to go to healthcare.gov to look to see what plans they offer because that is a life event change. Or you can actually go into the insurance provider's website themselves because they also recognize that as a life event change. There has been a change where before you could just go take a look. I say willy-nilly, but you could just go take a look and they would let you in by just saying, oh, well, I had a life event change. But now the insurance companies actually follow suit with the enrollment periods that have come up that healthcare.gov or the ACA, the Affordable Care Act set back in 2009, 2010. So they all follow suit with each other now. So if you lose your job, you're looking to Cobra, I always recommend before you Cobra, go take a look at healthcare.gov and communicate with the major insurance players in your state to see what plans that they offer, because you may be able to move into or under something that's a lot more affordable. Cobras are usually big pocket hits. So take a look at healthcare.gov. That's one good thing about the ACA that we didn't have before it, was that either you cobraed or you walked around without any healthcare coverage. So now you can take that time between the grace period to figure out what the best option is for you. All right, so I'm gonna go back to sharing the screen. Awesome, that was an awesome question. I appreciate that. So in line with telehealth, I was saying options for finding individual add-on, and these are only during like open enrollment periods that you could take a look at these. You can have a conversation with those companies just to see who they work with, or with your insurance company to see if they don't have it, what you can do for the upcoming enrollment period. Enrollment is usually November 1st. For most folks who are not Medicare, it's November 1st through December, the middle of December. For Medicare recipients, it opens up in October. And then you have from October up until December to make that decision. So those are a couple ways that you can look for telehealth. They do also, some of the companies will allow you to, and I'm trying to think and it's not coming to me. Some of the companies will allow you to utilize telehealth for a specific fee, right? So one that I know of, and the name isn't coming to me, they allow you to access a doctor or provider for $40, and they accept different pay types and processing types. So you would be able to access them for that $40, and then they can help direct you. So I think telehealth is a really good, telemedicine, interchangeable, is a really good option, especially when we have to stay home, and it helps you triage. You do sometimes have, yes, Jamie, I see that you have your hand raised again. Okay, so good question. Will the primary doctor change if you're using telehealth? And no, your primary will not change. And actually, the really good thing with telehealth, if it's connected to your insurance, whatever recommendations, findings occur during that interaction are documented and accessible by your primary. So if it's connected to your insurance and your primary, they are probably in some way, shape, or form using a system or platform that allows them to communicate with your primary's office. It may be still through fax or email or whatever, but that information will go to your primary if you want it to. So no, this does not change your primary. This just gives you an additional option to being able to access the two systems, right? Whether you need to be triaged or whether you have something going on or your family member has something going on. I do not. So one caveat here. I will say, as far as using telehealth, I always recommend telemedicine, telehealth for non-urgent situations, right? So if you have shortness of breath, and you have a primary, I will call your primary and let them know, because then they would direct you. Do you need to go to the ER, so forth and so on, right? If you if you have some change in mental status with yourself or a family member, call 911, get to a hospital, right? And then they'll figure that out. If you have chest pain, so all of the things that would usually be indicators of going to the ER, they are still indicators for going to the ER, and I would not recommend that you use telehealth in those situations. So telehealth is really for non-urgent situations, things that you could normally go to, you can go to the doctor's office for. That's really where I recommend that you use telemedicine. So I'm gonna check in with everybody on the telehealth and telemedicine piece, and how to get up and running, and where to find it and how to interact with it. Does anybody have any questions moving forward? I thought I saw something in the chat, so I'm just double checking. Moving around is my stuff. Oh, you have two questions, Yvonne? Go ahead. It normally would be urgent, but due to now, what would you recommend? Okay, so that's a great question. So the first question is, her son has some GI issues that would normally be urgent, and what do I recommend right now? So depending on the level of acuity, right? So how is this a chronic issue, or is this something that is acute and it's just uprising? If it's something that where it's multiple issues that happen regularly, I would still recommend moving into the telehealth. And I would like to ask you, if you want to take it offline, that's fine. But I also would like to know a little bit more about the duration, and then how was it managed before? Like, is this something that was managed? You said it would normally be urgent. So is it something that was managed by going into the doctor? And if it was something that was managed by going into the doctor, then you could quite possibly call the GI specialist if you have one and ask them how they are um, managing the care of their known patients. And that'll give you an idea of what's best, because you want to keep them you want to keep them aware, and you want to okay, managed by going in. Okay, great. So if it's managed by going in, I would call the GI specialist office and say, you know, this is what goes on with my child regularly. I know that we usually come in, but I also know that there are changes to the way that you are managing and caring for your patients. And I'd like to have a plan in place, right? For us to be able to know what we can do, should do in the event of XYZ happening, because we all know that this is something that can happen, right? I always recommend, when you don't have to, that's when you should initiate, because it's less, you don't have to think about it, right? You've already come up with the plan. It's already in place. You know, their pain is a 10 out of 10. When they have these symptoms, this is what our plan of action is, right? So I just go right into that plan of action. I don't have to freak out. I don't have to use mental energy. I don't have to figure it out. I don't have to do any of that. We already have a plan in place. So knowing that you have issues that are recurring and occur often, I would take this time when everything is nice and calm and set that plan. And if they give you gruff, be like, look, I know it's changed, but I need a plan of action, because I know that this is something that I'm going to have to deal with my particular child. I'm advocating for them now, because I know that we may not be in a mental space to be advocated, and I need to have something where I'm sure and secure of how you all are working and how we're working as a family. Okay. So that was your first question, Lavon. What was your second question? I hope I answered it. Did I answer it? Okay, awesome. Did you have a second question? Okay, go ahead. I'm ready. I'm looking at the chat. I'm giving her a moment. That was a silence. I'm letting her type in, because I know it takes time.
I'm gonna come off mute.
Oh, okay. There you go.
So with everything that's going on, what would you recommend someone who was already like going to see a psychiatrist, psychologist? I'm just thinking of my friends who have OCD,
Hmm.
and then going on how like mentally they would be able to prepare themselves whenever we do be able to go outside? Like, what would you recommend in that? Would that be like for them to go to like telehealth now and get those services, or would they have to wait till after?
So that's a really good question. A couple things. If they're managing their OCD well now, I would recommend that they reach out to, if they have a therapist that they have been seeing. I know some therapists are transitioning to a version of their services. Some of them are not, though. And I know Pennsylvania actually has also opened up for the mental health. Yes, pediatricians are doing telehealth. And I'll answer that in just a second. I know some therapists, Pennsylvania has opened up for the mental health department as well. A lot of therapists to be able to provide their services in a tele version, right? So is that telephone? Is that face to face? And it really depends on what the client's need is, and that's how they're meeting them. But if your particular therapist or your friend's therapist does not offer a telehealth version of the services that they provide, then that is where I would recommend that they get in contact with either their insurance, depending on how they're accessing those services, right? So if they're still in the EAP mode or employee assistance program mode, or if they're in the work-life benefit mode, I know some of those services that employers provide give you a certain number of visits that are covered, and then you go into your insurance. So, or you can call the insurance, because then it may move into you using your insurance, and ask them if they can provide them with telehealth enabled therapists. And sometimes you can yourself, and you can recommend this to your friends, they can go and look for a therapist, because this may actually be the better way to do it. If their therapist does not provide telehealth services, they can look for a therapist that does provide telehealth services, and then contact them. I always say ask for their NPI, which is their National Provider Identification Number, I think. Ask for their NPI number, because that's what's really going to designate whether or not your insurance company works with them. If you just give them their name and yeah, they'll be like, oh, they're on our list. But if you're giving them the NPI, then they definitely can go in and look and be like, oh yeah, they're definitely on that list, or they've come off, or maybe you'll have to talk to them, or something along those lines. OCD. And I just heard Howie Mandel on TV, because I know that he's one of our biggest well-known sufferers with OCD. And this is probably this is in a sense, right? Because a lot of them are germ phobes. I happen to be one, just because I know. But this time for them this is what they've always been doing. So it doesn't necessarily change there, but the level he was talking about, how he used to work through it when he wanted to was to have distraction, but being home all the time now, you don't necessarily have those distractions where you could go out, or you could do different things, or you're at work, or whatever the case may be. So you've lost the advantage of the distraction before they start getting into that point where it's like overwhelming, and they're kind of starting to lose it a little bit, or it's really starting to sit on them really heavy. That's when they need to start reaching out and asking about their providers and their therapists, and whether or not they have a telehealth. Because I always say, don't wait until it gets bad, because then by that time you're close to going over the edge, right? And anything can set you off. It could be the smallest thing. And this is for anybody that's in a vulnerable situation when it comes to your health. Anything can set you off. So when you're feeling it coming on, or when you're like, oh, I got an extra 12 hours to sit around and do nothing, let me initiate and do some proactive things for me and my health, because I know what could quite possibly be coming. And so, Levon, if that answered your question, I was going to speak it to the pediatrician telehealth. But before I do, did that answer your question, Levon? You come off mute, girl. Come on off mute.
Yes, it did. Thank you.
Okay, you're welcome. All right. So to the pediatricians offering telehealth. So yes, there are a lot of pediatricians that have moved. let me have moved into the telehealth. I know AI DuPont, a lot of the pediatricians that are affiliated with them have moved into the telehealth realm a couple years ago. And then I know Blue Cross Blue Shield has definite providers underneath their, because we're Highmark Blue Cross Blue Shield, so they have in their teledoc. I know that was one of the providers that was mentioned that they offer, and you'd be surprised as far as providers that have moved into that telehealth space, just because they want to give themselves a little more. They want to move into the tech, right? They want to meet their patients and their clients where they are. So pediatricians are there. A lot of therapists are there. Some are moving. And then you have general practitioners, and depending, some of the specialists that have actually moved over as well. So I would take the time to take a look and see who's covered under, if you do have the service offered, and then just know that they're there, and maybe start looking around and playing around to see what's available. Right. So, and how that platform works is, that's the other thing. Get familiar with the platform when you don't need it. So that way, when you're not flustered. Because tech, man, I tell you, it has a way of making, of pushing you over that edge. Just when you're like, no, I don't need to be pushed over the edge. And it's like, let me just push you over the edge. So I'm gonna go back to sharing my screen here. And okay, so telehealth. Now I'm going to move into urgent care versus ER versus look at that, I did it, and it went for me. I'm excited. So we're going to go into ER versus urgent care versus your doc, right? And so I understand that there are things that come up where you need to go to the ER, you need to go to the urgent care, and your doctor's just not available. I have a situation with our kids where I try to avoid the ER like the plague. And I usually say, hey, put a Band-Aid on it. Okay. Put a Band-Aid on it because we're not going to the ER. We're going to wait till your doctor's office opens. Um, for a couple of reasons. So the main reason is I'm a nurse. I already know that you're going to sit there for at least 4 to 6 hours, depending on what the situation is. And if I can get ahead of it by doing some things, um, we'll send. If I can get ahead of it, I will. If I cannot get ahead of it, and I saw, Jamie, that you had your hand raised, I just want to finish this really quick thought, and then you can come on in, you can unmute yourself. If I can get ahead of it, great. If not, I will still have a conversation, teledoc. So, looking at the chats, forgive me. Teledocs, telemedicine, telehealth, they all fall within that virtual space, right? So tele really just means virtual. And it's a virtual health tool. It's a virtual health platform. So teledocs also fall underneath that. And there's, you may, I think I showed the teledoc platform that we have available to us, just kind of to let you know that that's what it can look like. You may have some docs who do telehealth outside of the normal platform, telehealth, telemedicine platform, and then they just have a flat fee that they charge you. So and that's why I say it's important when you don't need it to go around and look and see what's available to you, and then what's out there, so that you can choose what's the best thing for your needs. Okay. Getting a few chats that I'm just paying attention to here. So with the ER, I try to avoid the ER because they're in ER and urgent care, right? So there's no real follow-up care with those, right? So ER and urgent care don't have follow-up care. They can't offer it. It's pretty much, I always say it's kind of like a clinic, and I hope you guys can hear me. Yeah, okay, great. It's kind of like a clinic where you're going to see a different provider every single time. And a lot of times that when we go to these places, we do require some level of follow-up care. And they are assuming that you have a primary, right? So if if you go to the ER or the urgent care and you don't have a primary, then you have to find a primary. And then you have to let your primary know what's going on, why you went to the ER, and then you're kind of starting that relationship all over again. So when you don't need it, find a primary, right? So that you can build that relationship. And I always talk about my husband and I watch football. So I always say that you are either the owner or you're the head coach of the football team, right? And then you have all these players and you have offensive coaches and defensive coaches and all of this, right? So you're the head coach, and then your primary is either going to be your offensive coach or your, yeah, offensive, well, your head coach. Your primary is your head coach, and then you have, you know, your specialist. So for me, my cardiologist would be excuse me, my defensive coach, my OBGYN would be my offensive coach. And then you have all these other people that are underneath them, right? Your GI specialist may fall depending on what your health status is. But you are the owner, the head coach, and then all of these other people are your players, and you have them do what you need them to do based upon your health and your status and how you're looking to maintain your health. So you're the coach, and then everybody else are your players, right? You're the puppeteer here. So with that, when you're in the ER or urgent care, you can't really puppeteer. You're kind of the one who's deferring. And it's just, you know, the ERs are great because they have CAT scans, they have other radiological studies that they could do, like MRIs and X-rays. They can even do some slightly invasive procedures just to see what's going on with you, depending on what your symptoms are that you the word is present with. There you go. What symptoms you present with. Urgent cares are even are more limited than the ER. Oh, and ERs definitely have laboratory and they can pop those out quick. Some urgent cares have radiological studies, so X-rays, general. They do have some labs there where they can get a couple things, and they can do some casting, you know, depending on if something's broken. They could do stitches, and they usually have PAs, physician assistants. Sometimes they have nurse practitioners, and then they have docs, right? And sometimes they may have like one or two specialist docs at the urgent care. The ERs are attached to a hospital, so they can pull in way more resources depending on what your situation is. Urgent cares are separate. They may have one or two specialists there. And then, of course, you have your provider, your primary care physician, who will send you out to people as necessary. But that's where your follow-up care comes from. So that's the difference between the three, the biggest difference between the three. And then there's also the monetary difference, right? So with an ER, depending on if they're in network or what the case may be, you may receive a bill from the actual ER facility, and then something separate from the doc, and then something separate from this person, and something separate. So they bill different ways. The urgent care may not be considered in network. Like, so you may be considered out of network with the urgent care. And it's always good I do a whole webinar series on your summary of benefits. I always say dive into it. So it's boring as hell, but it's necessary. Just start going in there and play around. And I did in my last webinar series, I did a whole thing on just getting in there and playing around with your summary of benefits or your benefits brochure. Some insurance companies are trying to make it foo-foo. So there's no follow-up care with ERs and no follow-up care with urgent cares. They don't have the resources to follow up with you, so they will refer you back to your primary. So you have to have a primary in place. And then urgent cares and ERs, as with doctor's offices, you're kind of opening yourself up, but really with ERs and urgent cares, a lot of times people don't know what they're walking in the door with. They're going there because they're trying to figure it out. At least with your doctor, if somebody's coming in with something that's serious or contagious, they have places that they can put them in the ER, and the urgent care does too, but they won't necessarily have them sitting in the waiting room, whereas the ER is just like, when we triage you and we get to you, we get to you. So you're not always sure what you're walking into and exposing yourself to in any of these environments, but a lot of times, especially the ER, because folks wait a long time when they go to the ER before something gets really bad, and then they're there. So I'm a big proponent of keeping in contact with your physician's office. If they send you to the ER, that's a different story. But if you're going there because something's really bad, maybe it would have been best for you to have that conversation with the doctor a little earlier to see if you could have gotten ahead of it. And I know that doesn't always happen, but that's the difference between the ER urgent care and your doctor. So I'm gonna move into the uninsured, uninsured, underinsured, and insured. Okay, so uninsured, underinsured, and insured. Because this is a big part of the CARES Act and the Families First Act. There's a lot of talk about people who are already insured and trying to get COVID covered for them. There is not really a lot being said for people who are either uninsured or underinsured. So I'm going to break down the difference, right? So uninsured, you have no insurance, right? None whatsoever. It's all at all, right? Underinsured, I always classify underinsured as having a high deductible plan, right? And I'll tell you why. If you are at a point where your deductible is upwards of $2,500, and that's just for you, the individual, and maybe $5,000 for the family, you have to put out at least $5,000 before any insurance is going to kick in. Now, mind you, because you're using your insurance and the provider is guaranteeing that they're going to charge you this contracted amount, you see the air quotes, you're still responsible for paying that. So you have to pay all of that copay and whatever the service costs to meet that deductible, and your copay does not go towards a deductible. So I define underinsured as anyone with a deductible higher than I'll say 1,500 individual, and we'll double that, 3,000 per family, right? Because you're coming out of pocket $1,500 plus whatever you're paying for your premium every month. So there's not, with the underinsured, because there's an ICD-10 code and you're getting care based on that with COVID, you would fall under that contractual amount. Now, who knows what that contractual amount is, because I think they're still trying to figure that out from an insurance standpoint. The uninsured, you're really you're in pretty much the same place that you would have been if you sought out healthcare when you regularly, right? So I always say proactive, anything, whether you're uninsured, underinsured, or insured, being proactive is always the best. But there's no real conversation being had around being uninsured and underinsured. And this is where I offered to have an individual conversation with you about what your situation is to help you do what's best for you, because they're not really any provisions in these two acts that have just come out, and they're not really talking about how they're going to take care of those who may have non-COVID related or non-COVID related care that needs to happen. So this is where that consultation comes in, where you can email me any questions that you may have. And then you can also, and then for insured, you're insured, you have some type of insurance, insurance coverage that reduces your out-of-pocket cost to a maximum amount, right? Insurance coverage that reduces out-of-pocket cost to a specific maximum amount. Oh. All right, and what that means is just when I've helped people figure out their insurance coverage, it's like, okay, your premium, your OOP is your premium, monthly premium plus copays plus deductible deduct. Thank you, Google Doc. And there's one other thing that I'm missing, but we'll use those three because those are the main three, right? Oh, and your co-insurance. There we go. Co-insurance. right? So that's what your OOP maximum is. It's your monthly premium, copays, deductible, and whatever your co-insurance. I do a whole stint on co-insurance, EOBs, and all of that. I could definitely share that with anybody that's interested. So that insurance coverage says, okay, this is the max that you're going to spend every year to access the healthcare insurance, the healthcare company, healthcare system, and it's kind of really it's not guaranteed, but that's the max, right? So that's the difference between uninsured, underinsured, and insured. And when it comes to using those three different categories, as far as accessing the healthcare systems, I know that they're all individualized, so we can definitely have a conversation about that. So I wanted to make sure I have notes over here, so I'm just taking a look. Yeah, so that is pretty much it right now. Know your major players. Look at their websites to see what they're doing for COVID and non-COVID related care. And then, you know, be familiar with your provider's website. And then, oh, I wanted to go up here because I wanted to talk real quick about what I'm using for information, because it can be overwhelming. It can be very overwhelming, right? Because you get information from everybody, and it's hard to just decide. So I started with the World Health Organization from the beginning of this, the advent of this in like December. I like the international perspective, just to see what other countries are doing, what World Health is coming up with. And then I kind of drilled down to the CDC as well. They have been, and they may have increased this a little bit more, but they have been keeping their information updated. I think it's like once a day. So around 12 noon, they'll update their website. And the old saying, when in Rome, really still falls into place, because whatever state, city, territory you are in, pay attention to their particular Department of Health website, because they're really going to tell you what that area is doing. And that really holds true to where, you know, what your responsibilities are, what their responsibilities are to you, what's going on. So those are the three places. And then the National Institutes of Health. Yes, I see that you have your hand raised. Sure, let me finish this thought and then I'll get right to you. The National Institutes of Health, actually, I hadn't been checking them, but I wanted to provide this information to you just in case you wanted to use them as a resource. World Health Organization, and yes, you can unmute yourself, sure, if you want, so that I can hear you, unless you want to type in the chat. Because I can't see, hold on. I'm gonna stop sharing really quickly. I can't hear anything that you're saying. Can you tap into the chat? There is a way, hold on, for me to, oops, I don't know
I
what.
think Sure may need to tap the video and then hit the microphone, then she can be heard.
Okay, because she's not in here anymore.
Yeah, we lost her.
Yeah, we did lose her. Hopefully she'll be able to come back, and then we could give her that that technical assistance. So you said tap the screen, and then
Yeah, you gotta tap her screen. Like Levon would need to tap hers, and then mute stop video comes up, and then that's how you turn your camera on and off, and that's how you turn your mic off and on.
Okay.
Because you can hear me through the service, not through the door, right?
Right.
Okay, cool. So
Okay.
that's how you do it.
Okay. All right. When she comes back in, I'll walk her through that process.
Oh, while you're there, I wanted to ask too, in regards to to COVID, say something does happen, what's the best way for us to determine which to use, either emergency, urgent care, or the doctor's office? Because with everything going on, with the hospitals been inundated with COVID victims, I wouldn't want to necessarily be there. Even so, even if I was having a heart attack. So should we have like an emergency plan in place, like a hospital in an area that we know is probably less used for that, or would that be a futile effort?
So I would recommend that you have a if you have a primary, that you call them and have a plan in place for what you're going to. Levon said, good question, Jamie. I would recommend that you have a plan in place and you call your primary office so that you know what it is that they're recommending you to do. The ERs are being very discerning on who they allow to come in and how they're triaging you, right? So if you believe that you have, even if you believe that you have COVID symptoms, the recommendation is that you're calling your primary and having a conversation with them about what your symptoms are, and then allowing them to direct you moving forward, right? Because it may be, one, you're coming into the office to get testing. It may be you're going to the ER to get testing. It may be that they're sending you to a COVID testing site. So that they actually are coming up with emergency action plans depending on how you're presenting and what your symptoms are. I would recommend doing that first. If you don't have a primary care physician, then my recommendation would be to call your state Department of Health and let them know what's going on with you, and then let them direct you. If you believe that you're having COVID symptoms, more than likely they're going to direct you to a COVID testing site and let you know, depending on the severity, and let you know, excuse me, what to do next. But that's kind of the backup. And then if you are to a point where you have shortness of breath, excuse me, or any of the other, change in mental status, symptoms and things along that nature, then call 911 and then let them take you into the ER. So that would be my recommendation. And I hope that answered your question. I know there were some technical issues. Sure hasn't come back in yet. Were there any other questions, Jamie? Okay. All right. I wanted to mention a couple things. So this recording will go out probably the beginning of next week. I will include in there some of the webinar series that I'll be doing moving forward. And I appreciate everybody for their attendance, their questions. It was great. And stay healthy. I wish you all the best. This is our new normal until something else changes. And I'm definitely here to answer any questions that you have. All right. Take care. Bye.